Meanwhile, government has begun rolling out the new Ghana Health Information Management System, GHIMS, in 20 health facilities nationwide. The state-owned GHIMS replaces the Lightwave Health Information Management System, LHIMS, after months of heated disputes with its provider, Lightwave e-Healthcare Solutions Ltd. A standoff that left several facilities crippled when the system was abruptly shut down. Well, after a successful run in 20 facilities, government is set to extend this to all facilities by close of the year. Evelyn Arba-Adu visited some of the facilities to see how the new system is reshaping operations and restoring seamless healthcare delivery.
450 health facilities were forced back to pen and paper sometime this year after their Lightwave Health Information Management System began failing. The electronic platform, designed to improve patients' data access, streamline administration, and coordinate care, had become unreliable. The situation hit rock bottom in September when the service provider abruptly shut down the system, grinding healthcare delivery to a halt and prompting the health minister to address the crisis publicly.
It's unconscionable for any individual or company to have access to the medical records, electronic medical records of Ghanaians without the state taking control, without the state having access to it, without having even access to the service.
Lives of patients in these 450 health facilities stood at risk as what once was an automated system for information management had taken a step back to a slower manual method. To salvage the situation, the Ministry of Health urgently introduced GHOne information systems to build a more robust application, one designed to keep facilities running without disruption, and this time, a fully state-owned system.
It will be difficult for anybody to say, I'm going to take data like what we have currently. So it is a very robust, solid, and foolproof system. It's owned by government.
Having heard the claim of a foolproof system, the news team set out to see how the new Ghana Health Information Management System, that is GHIMS, was performing in selected facilities across the capital. At the Greater Accra Regional Hospital, the outpatient department had the system already live, with the area noticeably less crowded compared to weeks back. Records personnel worked swiftly behind their stations. Eunice Alote is a patient who walked in that day. She tells the news team her processing took less than 2 minutes, a major improvement compared to the long delays she had recently endured.
System no, fast my chain paper no, and we fast say ube jina wa, omo bisa on sem no mu we pa omo se ko, ube bru hana ubibia wo system neso.
Head of the IT department at Bridge, Isaac Achon, revealed that the facility began piloting the system on November 10, with full implementation on November 13, and by Thursday, November 27, over 5,000 OPD patients had already been captured due to the speed.
The speed keeps on improving day in, day out. Over the 2 weeks period that we have successfully gone far into the implementation, I can confidently say that the performance in terms of the user management and manipulation, as well as the application's performance, has improved greatly.
At the country's largest health referral center, Kolebu Teaching Hospital, 7 departments, including child health, maternity, and the polyclinic, are already running on the new software, with 2,985 OPD patients captured since November 13. Robert Adu, head of IT at the Kolebu Teaching Hospital, assesses the system.
The system is a web-based, which is accessible by any smart device or any device with a browser. And the accessibility is real-time. which means that between 1 second to 10 seconds, the result must be produced for the user to continue doing.
Our final stop was the Nima Polyclinic. Administrative Manager for Records, Oxborn Akolachem, told the news team that GHIMS has improved features including patient photos and richer internal data, a huge upgrade from the old Lightwave platform. He prayed that a change in network provider would be seen next.
It comes with the fees. You'll be able to reconcile the fees with the name and details that comes. My issue is with the intermittent fluctuations with regards to the network.
Nima Polyclinic went live on November 14, and Zainab Idris is one of the 600 patients already processed under the new system.
It was fast.
The system now handles everything the National Health Service needs in one place, from checking if someone's NHIS card is valid to sending claims, payments, and keeping track of all approved health providers. All the information goes through one organized, easy-to-track digital channel. When a hospital starts using it, a support team stays on site for a while to help them fix any issues with their forms, patient queues, or billing. All 450 facilities previously on the Lightwave system are expected to migrate substantially to the Ghana Health Information Management System by the end of the year. But for now, all teaching hospitals, including Komfo-Anokye Teaching Hospital, Cape Coast Teaching Hospital, Sunyani Teaching Hospital, and Ho Teaching Hospital, as well as regional and some district facilities, have gone live with the system. Evelyn Araba Edu, reporting for GHOne News and Star FM.